Every medical breakthrough you rely on today, vaccines, transplants, dialysis, even the way we understand digestion, has an origin story. Some of those stories are inspiring. Most of them are not. This is 10 more medical firsts that changed history, but at a cost almost nobody would accept today. Before vaccines existed, doctors used a riskier technique called variolation, deliberately infecting a healthy person with a small amount of smallpox material to trigger immunity. In 1721, English physicians wanted proof that it was safe enough to use on the royal family. So they tested it first on 6 condemned prisoners at Newgate Prison, offering them a pardon if they survived. All 6 lived. Encouraged doctors then ran a second trial, this time on a group of orphan children who obviously had no ability to consent. It worked, and the royal children were inoculated soon after, but the proof of concept had been bought from people who had no real choice in the matter. 75 years later, English physician Edward Jenner took the idea further. He'd noticed that milkmaids who caught cowpox, a mild relative of smallpox, never seemed to catch smallpox itself. So, Jenner took pus from a cowpox sore on a milkmaid's hand and scratched it into the arm of a local boy named James Phipps. James got mildly sick, then recovered. Then came the real test. Weeks later, Jenner deliberately exposed James to full-blown smallpox, the actual disease, to see if the experiment had worked. It had. James never developed smallpox. The word vaccine, from vacca, Latin for cow, was born from that one boy's body. Yes, he survived, but by any modern standard, deliberately infecting a child with a deadly disease to test a theory would never be allowed to happen again. In 1822, a young fur trader named Alexis St. Martin was accidentally shot in the stomach at close range. Army surgeon William Beaumont saved his life, but the wound never fully closed. It healed into a permanent opening, a fistula, straight into St. Martin's stomach. Beaumont realised he was looking at something no scientist had ever had access to, a living window into human digestion. Over the next several years, he tied pieces of food to a string, lowered them directly into St. Martin's stomach through the hole, and pulled them back out hours later to study how far digestion had progressed. St. Martin, an uneducated labourer with few options, became Beaumont's research subject for nearly a decade, sometimes willingly, sometimes resentfully, and occasionally running away only to be tracked down again. The data became the foundation of modern gastric physiology. St. Martin lived into old age, and Beaumont got the credit. On December 3rd, 1967, South African surgeon Christiaan Barnard performed the first human-to-human heart transplant, giving Louis Washkansky the heart of a young woman who had just died in a car accident. For a few days, it looked miraculous. Then, Washkansky's suppressed immune system, deliberately weakened so his body wouldn't reject the new heart, left him unable to fight infection. He died of pneumonia 18 days later. It was a landmark and a warning at the same time. Humanity could now move a heart from one body to another, but had not yet solved the problem the surgery itself created. That problem, organ rejection, would haunt transplant medicine for decades after. In Japanese-occupied Manchuria, a secret military facility called Unit 731 ran one of the most extensive human experimentation programs in history. Researchers deliberately infected prisoners with plague, cholera, anthrax, and other diseases to study how they spread and killed. Some victims were subjected to vivisection, surgery performed while still alive and conscious, to observe the effects of disease on internal organs in real time. Others had limbs frozen to study frostbite, or were placed in pressure chambers to see at what point the human body would fail. After Japan's surrender, many of the scientists responsible avoided war crimes prosecution by handing their research data over to American occupation forces. The information was absorbed quietly into Cold War biological weapons research. At a Dachau concentration camp, Nazi doctors ran a series of experiments to determine how long a human body could survive in freezing conditions. But researchers framed it as helping rescue downed Luftwaffe pilots who crashed into icy waters. Prisoners were forced into tanks of ice water or left outside naked in sub-zero temperatures, while doctors recorded their declining body temperature and vital signs. Some victims died during the experiments. Survivors were sometimes subjected to brutal rewarming methods, including being placed between the bodies of camp prostitutes, also tested as a treatment. The research was scientifically sloppy and ethically indefensible, yet some of the data quietly circulated in post-war medical literature for years before its origins were fully reckoned with. Austrian psychiatrist Manfred Sackel introduced a radical new treatment for schizophrenia. He deliberately induced a coma by giving patients massive overdoses of insulin, crashing their blood sugar to dangerous lows. The theory was that the resulting coma and the seizure-like state that sometimes followed would somehow reset a disordered mind. Patients were kept in repeated comas, sometimes daily, for weeks at a time. The treatment carried a real risk of permanent brain damage or death, and recovery, when it happened, was hard to distinguish from spontaneous remission. The coma therapy spread through psychiatric hospitals worldwide and was used for roughly 3 decades before being phased out, not because it was proven safe, but because better alternatives eventually came along. Long before modern surgery, attempts to separate conjoined twins were often acts of desperation, curiosity, or showmanship rather than careful medicine. Performed without anaesthesia and with little understanding of shared organs or blood supply, early separation attempts carried brutally high mortality. In some documented cases, the motivation seemed to have more to do with the surgeon's ambition or public spectacle than the twins' own well-being. Conjoined twins had long been treated as curiosities to be displayed before they were treated as patients to be helped. It would take the development of anaesthesia, antiseptics, and modern imaging before separation surgery became a more realistic medical option rather than a gamble. When kidney dialysis became available in Seattle in the early 1960s, there weren't nearly enough machines for everyone who needed one. So, the hospital created an anonymous committee of ordinary citizens, a lawyer, a minister, a banker, and a homemaker, to decide who lived and who didn't. The committee reviewed candidates' family situations, jobs, and perceived social worth, often favouring married breadwinners with children over single people, the elderly, or those seen as less productive. A Life magazine expose in 1962 made the process public, sparking national outrage over the idea that a panel of strangers was quietly rationing survival itself. The backlash helped push Congress toward a major policy shift a decade later, making dialysis a federally funded benefit for nearly all Americans who needed it, removing the committee's grim role entirely. In the late 1940s, US Public Health Service researchers ran a covert study in Guatemala to test whether penicillin could prevent sexually transmitted infections. To do that, they needed people who were actually infected. So researchers deliberately exposed prisoners, soldiers, psychiatric patients, and sex workers to syphilis and gonorrhea, sometimes through infected prostitutes, sometimes through direct inoculation, without telling subjects what was happening or obtaining real consent. more than 1,300 people were infected. Some were never treated at all. The study stayed hidden for over 60 years until a historian uncovered the records in the 2000s. In 2010, the US government formally apologized to Guatemala, one of the few times such experiments led to an official admission decades after the fact. And get this, the experiments were led by physician John Charles Cutler, who also participated in the late stages of the Tuskegee syphilis study. American physician Samuel Morton set out to answer a question he'd already decided. Were certain races biologically superior to others? His method was to collect human skulls, over 1,000 of them, many taken from graves, battlefields and burial sites without any permission from descendants, and measure their internal volume by filling them with seed, then later lead shot. Morton ranked the skulls by size and used the results to argue for a strict racial hierarchy, with white Europeans at the top. The work was presented as objective, quantitative science, and it was treated as such for decades, cited by slavery advocates in the United States and segregationists long after. Modern reanalysis of Morton's own data found that his measurements were riddled with errors, and that those errors consistently favoured his pre-existing racial bias rather than cancelling out randomly. The skulls themselves, many belonging to indigenous and enslaved people, were collected without consent and held in museum collections for generations, some still being repatriated today. Craniometry didn't just produce bad science, it gave a veneer of medical authority to racist policy for the better part of a century. There you have it, 10 breakthroughs, 10 debts paid by people who mostly never got a say: prisoners, orphans, enslaved people, colonised populations, the poor, and the institutionalised. None of this means the resulting medicine is fake or the progress wasn't real. Vaccines save millions of lives every year. Transplants and dialysis keep people alive today who would have died decades ago. But the foundation of modern medicine was built in no small part on the bodies of people who never got to choose. That's worth remembering every time we talk about how far we've come. As always, thank you for tuning in. Which of these medical firsts shocked you the most? Leave your answer in the comments and click that like button for more top 10s like this. Until next time, fly safe.